Les invitamos a todas y todos que puedan ubicarse en sus respectivos espacios.
We would like to invite you,
Vamos a
all of
comenzar
all,
en breve.
you to start this. We're going to start shortly.
Bien. Muy buenas tardes.
Good
En nombre
afternoon.
del Ministerio de Salud, la
On behalf
Organización
of the Ministry of
Panamericana de la
Health,
Salud y
the
la Alianza
Pan
para la
American Health
Investigación
Organization,
de
and the
Políticas
Alliance
y Sistemas
for
de Salud
Research
de la
of
Organización
Healthy
Mundial de la
Policy
Salud,
Systems
les
Research,
damos la bienvenida a esta
HPSR,
ceremonia de
we would
celebración
like to welcome
del
you to
25
this celebration
aniversario de la
of the
Alianza para la
25th
Investigación de
anniversary
Políticas
of
y
the
Sistemas de
Alliance
Salud,
for Health Policy
encuentro
Systems
denominado
Research.
La evolución
This has been
de la
called the
investigación de
evolution
políticas y
of
sistemas
health
de salud,
policy and systems
reflexiones
research,
y nuevos horizontes.
reflections and new horizons.
Saludamos ahora
We would like
a
to
todos y todas
welcome
quienes nos acompañan.
everyone who's participating with us here today.
Partimos por la
Let me
señora Isén
start
Echeverry,
by
ministra de
Isen
Ciencia,
Echeverry,
Tecnología,
Ministry of
Conocimiento e
Science,
Innovación de
Technology,
Chile.
Knowledge and Innovation of Chile.
Muchas gracias. La subsecretaria
The Undersecretary,
Francisca Gallegos, la
Francisca
subsecretaria
Gallegos,
justamente de MIDESO, el Ministerio de Desarrollo
the
Social,
Undersecretary of the Ministry of
la
Social
subsecretaria de
Development,
Servicios Sociales,
the Undersecretary of Social Services,
el doctor Fernando Llanes, representante
Dr.
del Colegio de
Fernando
Inmunología
Leanes,
Chile,
representative in Chile for PAHO and WHO in Chile,
la señora Helen Clark,
Mrs. Helen
presidenta de la
Clark,
Junta Directiva de la
former
Alianza para
Prime
la
Minister
Investigación de
of New
Sistemas y
Zealand
Políticas
for
de
the
Salud,
research of policies on health,
y además ex primera ministra de Nueva
and
Zelanda.
the ex-former Prime
La
Minister.
señora Janet Vega,
Mrs.
vicepresidenta de la
Janet
Junta
Vega,
Directiva de la
Vice President of
Alianza
the
para la
Board of the
Investigación de
Alliance for
Sistemas y
Health
Políticas de
Policy
Salud.
and Systems Research of WHO.
Y también vamos a saludar a
And
los
we would also
panelistas
like
que nos van a
to
acompañar
welcome the
hoy.
panel members who will be with us today.
El señor Kumanan
Let's start
Ranasatán,
by
Ranasatán,
Mr.
perdón, que es el
Kumanan
director ejecutivo
Rasanathan,
de la Alianza para
the
la
Executive
Investigación de
Director of
Sistemas
the
y
Alliance
Políticas de
for
Salud.
Health Policy and Systems Research, or WHO.
Alain Labric,
Mr. Alain
director
Labrique,
de Salud Digital e
Director of the
Innovación de la
Digital Health
Organización
and
Mundial de la
Innovation
Salud.
Department for the WHO.
El señor Jeremy Farrar, jefe
Mr. Jeremy
científico de la
Farah,
OMS.
Chief Scientist of
El
WHO.
señor Gabriel Radá, fundador y
Mr.
presidente de
Gabriel
la
Rada,
Fundación
founder and
de
president of the
Epistemónicos de Chile.
Foundation Epistemónicos
¿Está por
in
ahí?
Chile.
Carol Zabaleta, que es investigadora de
Carol
la Universidad
Zabaleta,
Cayetano Heredia de Perú.
Indigenous Doctor, Researcher, and Welcome International Training Fellow of Universidad Cayetano Heredia in Peru.
Durante los últimos 25 años,
During the last
el campo de la
25 years,
investigación
the
sobre
field of
políticas y
research
sistemas de salud
about
se ha convertido
policies
en
and
una
systems
piedra
research
angular para
has
lograr
become a
sistemas de salud
cornerstone to
sólidos
obtain
que permitan
sound
poblaciones
systems that enable
saludables, que
healthy
garanticen la
populations
seguridad
that
sanitaria
guarantee and
y que
safeguard the
alcancen los objetivos de
sanitary health
desarrollo
and
sostenible.
also reach
El
the
encuentro que hoy nos convoca
SDGs.
busca hacer una reflexión
This
sobre
meeting
cómo la
is about
investigación de
reflecting
sistemas
upon
y
how
políticas de
the
salud pueden
health
contribuir
policy
a
systems
abordar
and
desafíos
research
y
could
tendencias claves
contribute
en el contexto
to
de un
talk
mundo
about
que
general
enfrenta
context in
múltiples
a world
crisis
that
para
faces
mejorar la
different
salud
crises to
y la
improve
equidad en la
health
salud,
and equity in
incluso
health,
en América Latina.
even in Latin America.
Este es el séptimo de
This is
una
the
serie de
seventh
eventos celebrados
of
en todo el
many
mundo
events
para
that have been
conmemorar el
celebrated all around the world
25º
to commemorate
aniversario
the
de la Alianza para
25th
la
anniversary
Investigación
of the
de
Alliance
Sistemas
for
y Políticas de
Research
Salud.
and Systems.
Se realiza en colaboración con el
This
Ministerio de
is
Salud,
with
el
the Ministry
Ministerio
of
de
Health,
Ciencias, Tecnología,
Ministry of
Conocimiento
Science
e
and
Innovación
Technology,
de
Knowledge
Chile
and Innovation of Chile.
para iniciar este encuentro, dejo
And
con
to start this
ustedes
event, let
al
me
doctor
yield the floor
Fernando Llanes,
to Dr.
representante de
Fernando
la
Llanes,
OMS
who is a
UTS Chile.
representative of
Doctor Fernando.
WHO in Chile, in PAHO as well.
Muchísimas gracias. Quiero saludar muy
Thank you very
especialmente
much. Let
a
me
las autoridades
please
del gobierno
welcome
chileno, a la
especially the
doctora
Chilean
Aysen
government
Echeverry,
authorities,
ministra de
Dr.
Ciencia,
Aysen Echeverry,
a
Minister of
las
Science,
autoridades del Ministerio de
the
Desarrollo
authorities
Social,
from the Ministry of Social Development,
a la Junta Directiva de la
the executive
Alianza
board
en el nombre de
of
su
the
presidenta Helen
Alliance
Clark
on
y
behalf of Ellen
de su
Clark, her
vicepresidenta, la
president, and the vice
querida
president,
doctora Janet Vega.
Mr. Janet Vega of the
Y
Alliance
cada
for Health
uno
Policy and
de los
Systems
miembros
Research,
del
and each
board que
one
hoy
of the
están
board
presentes,
members that
a
are with
los
us here
colegas,
today,
muy especialmente a los
our
colegas del
colleagues
secretariado de la
from
OMS
the
que están
Secretariat of the
acompañando la misión de ustedes,
WHO who are here with
em,
your mission,
y a todas y todos los
and
presentes.
everyone who is
Eh,
attending these meetings.
Realmente celebramos todos, yo
We
creo, estos
truly
25 años
celebrate these
de
25
trabajo, estos
years of
25
hard
años de
work,
acercar
these
evidencia,
25 years
de
of bringing
acercar a los
along
países
evidence and
motivación
countries
de distintas maneras
with
para
certain motivations
avanzar
and drivers in different
en
manners in order
políticas
to move forward
de salud.
in terms of
Y
health
en este año
policies.
nosotros lo
And
celebramos de
during
manera
this
muy
year,
especial
we are
porque es
celebrating
el
it in a
año de
very
la
special manner
COP28,
because this is the same
es un
year
año
of
clave para la Agenda
COP28. In
2030
other words,
y en
it's a key
particular en la
year
región de las
for our
Américas
Agenda
estamos también
2030. And in
celebrando
the Americas
el
region, we are
inicio de una
also
alianza con el
celebrating
Banco
the
Mundial
starting
y
point of an
con
alliance with the World
el
Bank
Banco Interamericano de
and with
Desarrollo
the Inter-American Development
para
Bank
expandir la
to
atención primaria de la
expand
salud.
the
Y por esa
primary
razón hay
care.
algunos miembros del
That
equipo
is why
chileno que
we
no están
have
presentes
members of
porque
the
están
Chilean team who are not here
en esa tan importante reunión
because they
con
are
nuestras
in that
autoridades
important meeting with our authorities,
regionales.
our regional
Y
authorities.
les quiero agradecer
And I
a
would
las
like
autoridades
to
de Chile
thank all the authorities in
y al
Chile
board y a la
and
junta
the
directiva de la alianza
board
por estar
of the
aquí en la región de las
alliance
Américas, por estar
because you're here in
porque
the
podamos estar hoy
Americas
acá en
region,
Chile
and also because you're
celebrando
in Chile
este
celebrating
aniversario y en
this
esta misión tan
anniversary,
importante que están
and
llevando
in
adelante.
such an
Sé que
important
en estos
mission.
días
I
estuvieron
know that during these
los
days,
miembros del board
the
y los
members
colegas
of
de
the
OMS
board,
de
as
Ginebra
well as
estuvieron
the colleagues
recorriendo
of
el
Geneva
país.
of WHO,
Vemos algunas de
have
las
been
expresiones de lo que se
around
está
our
haciendo
country,
en materia de
and you have
salud
been witnessing some of the things
en
we're doing
una
in
visión
terms
de
of health
desarrollo que yo creo que es
in a
súper
development mission
importante
that I think that is
que
very
está llevando
important
adelante esta
for
administración.
everyone.
Y yo estuve la
And
semana
I
pasada en
was
la reunión
last
de
year
directores de la OPS
looking
y
at the
realmente celebramos
OPS, and I
mucho
think that we celebrate, truly celebrate
la aprobación del presupuesto del Estado chileno,
the
que
budget
tiene un aumento muy
that
importante
has
en materia de salud y también en otras
increased
políticas de desarrollo,
or improved
que
in terms of
incluye,
the development
y esperemos que
efforts.
esto se
And
pueda
that also
producir en
includes,
el
and
año
hopefully this
2024, que
will
incluye la
be taking
ampliación de
place
lo que
also in
ustedes vieron en
2024,
Renca,
that is the
que
extension of
es
what you saw in Renca,
la universalización de
which
los
is the
servicios que se dan en la
universalization of the
APS y
services
que se
that we
dan
have in the APS,
con una base
and also
con
with
un
our
abordaje de
primary health
determinantes y con una
care,
fuerte
and also
participación
with the
social.
strong social
Este es
participation.
el camino
This
que
is
las
the
Américas
path
está
that the
abrazando.
Americas is now
Nuestra
embracing,
directora
that our
anterior,
director,
Carissa
our former
Etienne,
director, Carissa Etienne,
lanzó en el año 2013
started
como
in
meta del secretariado en la
2013
OPS y después
as
también fue
a goal for
bandera
the
del doctor
Secretariat,
Tedros.
and it was also the flagstone
Lamentablemente,
of Dr.
el
Pedros.
viernes de la
Unfortunately,
semana pasada falleció la
Friday last
doctora
year,
Etienne.
Dr.
Justo estábamos
Etienne
todos
passed away.
en la OPS
We were
juntos para
all in
celebrarlo
the PAHO
y
together to
todos nos
celebrate that other
acordábamos de
event,
este
and we all
impulso que ella
remembered
dio
the
en las
boost that
Américas
she
a
certainly
avanzar en
gave
la
to the
cobertura
Americas
universal en salud,
to try to move
pero
forward
una
into this
cobertura universal
coverage,
en
health
salud
coverage, but a universal health
que
coverage that is
involucre también el
based and
acceso, que
involves
involucre también
the
a los
access
determinantes de salud
and
y en última
also the
instancia
health
que
determinants,
tenga
and also
esa
in the long run,
visión de atención
that it also
primaria a la
has this
salud
vision of
que se
primary health
planteó
care,
en el año
which was stated
1978
in
para los que
1978 for the ones
están metidos en
have
estos temas
who
en
are
alma ata.
in these areas,
Después ha,
and that
digamos, seguido
afterwards it
renovándose
has
en asparo.
evolved
Yo
and
creo
been
que
renewed.
este
I think that this
para
is
nosotros un evento
for
muy, muy
us
especial. Es,
very
los
important.
25 años son una celebración muy importante,
25
pero
years
más
are
importante yo
certainly
creo
very
que es
important, but
lo
I
que va a
would say
ocurrir
that
a
it's even more
continuación,
relevant
que
what
es
will
el
happen
panel
afterwards,
en
which is
donde
the
se va a
panel that
analizar
we
la
will have here,
evolución
because we will
de la
analyze the
investigación de
evolution of
políticas de
this
salud y se va a
health
reflexionar
policy and systems
sobre
research,
esto.
and
Y
we are going to
quiero
reflect upon that
presentarles
matter. And I would
a
like to invite
un compañero de la OMS, al doctor
our
Kumanan
friend from
Rasanathan.
the
Él es el
WHO,
director ejecutivo
Dr.
de la
Kumanan
Alianza
Rasanathan.
para
He is the executive
la
director
investigación
of the Alliance
de
for
políticas y
Health
sistemas de salud,
Policy and
y él
Systems
de alguna
Research.
manera es el
And
que,
somehow,
espero
he
yo,
is the
de
one
manera
that I hope
efectiva esté dando
effectively
a través de
will,
todo su equipo un
through all his
importante
team, will
apoyo a
certainly
la Junta
support
Directiva.
the
Muchísimas
executive
gracias.
board. Thank you
Adelante,
very
doctor.
much. That's all.
Buenos días,
Good
buenas
morning
tardes a
or good
todos.
afternoon, everyone.
Good afternoon, and it's a real honor and pleasure to be here and with the ministers, vice ministers, senior colleagues, representatives from embassies, and ladies and gentlemen, it's a real pleasure that we can celebrate this event here. I'm going to moderate a panel shortly, but my first duty is to invite the Right Honourable Helen Clark, the former Prime Minister of New Zealand, former Administrator of the United Nations Development Programme. But she's here speaking today as the Chair of the Board of the Alliance for Health Policy and Systems Research. So I'd like to invite Helen to give a keynote just on this theme to start us off today. Thank you so much.
Thank you, Kumanan. Buenos tardes, ministers, excellencies, senior officials and members of the research community. And can I begin by very much thanking the Minister of Health and her team at the Ministry for co-organising this event today with the Alliance for Health Policy and Systems Research. And many thanks also to the Minister of Science, Technology, Knowledge and Innovation and her team for their hospitality to us today as well. I want to especially acknowledge too former Minister Dr. Jeanette Vega, who's my Vice Chair at the Alliance Board. Jeanette encouraged us to come to Chile this week and see all the things that are happening in the health scene. And we've really been hosted so well by all of you and your teams, so thank you very, very much. I became Chair of the Board of the Alliance at the beginning of this year, but I'm not new to the health issues that we're discussing. A long time ago, I was Minister of Health in New Zealand. I continued to take a very close interest in health as Prime Minister, and then as PNUD Administrator. Currently, I'm also chairing the Partnership for Maternal, Newborn and Child Health, which, like the Alliance, is hosted at the World Health Organization in Geneva, and also the Global Commission on Drug Policy I chair. I co-chaired the independent panel on pandemic preparedness and response, which had its mandate from the World Health Assembly. Achieving better health and well-being for everyone and achieving well-functioning health systems has long been very important to me, and I know how vital it is to have the research evidence to inform those achievements. These days, our health and health systems are being impacted by the multiple crises affecting our world. At the Partnership for Maternal, Newborn and Child Health, we coined the phrase of the challenges of the 3 C's of crises, the COVID-19 pandemic, the climate crisis, and the conflicts which are besetting our world, all of these throwing up huge challenges to health and well-being. Clearly, climate change is an ever clearer threat with major implications for human health and good that for the very first time ever at a conference of parties for the Climate Change Convention, that there was a health day in Dubai. The countries experiencing profound conflict are seeing lives destroyed and health facilities overwhelmed by need and often themselves the targets of violence. And then everywhere we saw how the COVID-19 pandemic exacerbated existing social and economic inequities and impacted on our ability to achieve global and national health targets. Take, for example, the global targets around reducing maternal mortality, on which progress stalled. The WHO report is very sobering on that. Last year also, WHO and UNICEF reported that since the onset of the pandemic, there had been the largest sustained decline in childhood vaccinations in approximately 30 years. So the pandemic really rocked our health systems globally. But this week, our focus has been around how Chile is tackling its reform agenda. We have heard how you're investing in research and learning. We have heard a lot about the major reforms being undertaken in primary health care, your thinking around digitalisation, determination to tackle health impacts of climate change, to name just a few issues in health. Our speakers today are going to share a range of insights and perspectives, but I think where we will all converge is on this vital role of health policy and systems research and learning in informing the progress we make. And in that respect, let me make 3 brief points. 1, health policy and systems research can be a bridge that takes us from ambition and aspiration to implementation of change, because it can help us document what has worked and what hasn't worked. It can help us learn. It can help us improve implementation. And as we reflect on, frankly, the poor progress made recently on achieving universal health coverage globally, as revealed by the new WHO World Bank Global Monitoring Report, we can also celebrate the journey towards universal health coverage in countries like Chile, where key barriers to and the facilitators for UHC have been identified. You have extensive data and analysis on health services utilisation and cost effectiveness, and also on the social determinants of health, which you're tackling as well. Second point, health policy and systems research can help build collaboration. The pandemic underscored how important partnerships across sectors are for effective responses. Health policy and systems research can contribute to creating this system-wide thinking. Again, I think something that's very much impressed our board and the Alliance staff on this visit to Chile has been to see how you are working to align this impressive social care model with the primary health care model. This is very significant, and one a model which more needs to be known about globally. And Chile should not be modest in telling the world about what it's achieving. You're a small country like New Zealand. We're often too modest. Please tell the world about what you're achieving in these areas. My third point, health policy and systems research can and must keep equity front and centre and help us understand the complexities of the intersecting health challenges. You know, all these major crises do exacerbate existing inequalities. The climate crisis magnifies those, the pandemic did. And we need to address these challenges in integrated ways. I have been associated with the preparation of a new report, Pathfinder Initiative report, which is looking at how you can co-design policies for health benefit and for climate action simultaneously. If we think in silos, we won't do the job. How can we co-design to get the best in tackling both these challenges? So, despite all the challenges all our health systems face and the challenges we face globally for health, so many of them very urgent, so many of them formidable, many of them both formidable and urgent, there are tools at our disposal to address them. Research and learning are not some nice to have, maybe one day accessory. Rather, they are essential to helping us navigate the complexities of health systems and policies and helping us find new solutions and allocate and reallocate resources to get the most benefit. So research isn't just an extra cost, it's a strategic investment, a foundation on which we can build stronger, more resilient, and more equitable health systems for everyone, everywhere. The Alliance for Health Policy and Systems Research is about to launch its new strategy, pending board approval this week, focusing its work in 5 areas across primary health care as a contributor to universal health coverage, digital health, the non-communicable diseases, emergency preparedness and response, and then tackling the climate and health issues together. We'll be talking about this a lot more, so stay tuned. And once again, thank you so much to the ministers, their teams, the research community for making us so welcome in Chile this week and sharing your invaluable experiences with us. Muchas gracias.
We thank the presentation given by Ms. Helen Clark. In this ceremony where we celebrate the 25th Alliance of Research of Policies and Health System, we will start with the panel. The conversation panel that's the role of research in policies and health systems, and cares to be able to have an approach of present crisis. The Undersecretary of Social Services of the Ms. Francisca Gallegos will participate in the panel. A round of applause for her, please. The scientist and head of health, Jeremy Tara. We invite each of them to please be seated. To the Director of Epistemologos, Dr. Gabriel Rabat. The Director of Digital Health and Innovation of the WHO, which will be online for this conversation. And also the researchers and indigenous doctor of the University of Cayetano, Dr. Carol Zabaleta, and we welcome her. Thank you so much. It was the panel, Dr. Kumanan Rasatan, who we invite him so he can come to the podium. Once we have finished with this conversation, we will start with an open discussion from the different points of view that have been presented in each of these.
Muchas gracias. And,
thank you.
Thank you again so much to the Ministry of Health and
Muchas
the Ministry of
gracias.
Science, the ministers for hosting us here and giving us this opportunity to have this discussion here in Santiago, in Chile. And also thank you to our colleagues at HPSR here in Chile, Dr. Leanes, for opening today. We have an illustrious panel here today to really following, thank you, Prime Minister Clark, for your opening words on, well, you're biased because you're the chair of our board, but I know you really believe in the power of research and learning to drive improved outcomes, both for health, for social and economic progress in the work that you've done. We now have this panel to reflect on a range of different areas on how health policy and systems research, applied learning can contribute to addressing some key challenges, and each panelist will speak from their own perspective. And people will speak in either English or Spanish, and you will have the translation. We also have the translation online. So please speak whatever you prefer. I myself do speak quite bad Spanish, but just to preserve everyone's ears, I'm speaking in English for this session. So firstly to you, Undersecretary Gallegos, a big social protection agenda. We saw yesterday in a primary care center in Renca, the plans for linking between health and social protection. But I know you're also embarking on an ambitious agenda on social care. So over to you, Undersecretary, to let us hear more about social care and also how research and learning can contribute.
Bueno, muy buenas tardes a todos y todas. Muchas gracias por la
Good
invitación.
afternoon. Thank you for the invitation. It's an honor to be with you and to have as a center the value of research as an evidence so we can go with challenges that are not only related with symptoms, but also with structural aspects. So here's what we want to start with. I want to start saying or thinking that the convergence, if we want to achieve things among different sectors, but we do that when we want to see these translated in every process of public policies. What I want to share with you is an effort that we're having in Chile, that this convergence for this intersectorial, and we are talking about policies at central level, but mainly in the operative working areas as it has been happening at a local level, as you saw this in record. But this strategic agenda at the universalization of primary service and to take a primary care, universal primary care as what we're trying to do. And I think this is the way we can achieve intersectorial. In Chile, for social protection, to overcome poverty, we wanted to improve what we had increased in poverty during the pandemic, and now we're back with the previous figures. But when we're thinking in the multidimensional poverty in children and vulnerability of families in Chile, we can see that there are great obstacles that are not related with the capacity of people, but with structural conditions. And in this context, we can see that our social protection system has a great challenge and different types of challenge. We have to take care of the problems we have with democracies, technological changes, and the aging that we are looking now in the population, and social protection system that we want to have a adaptation system, resilience, and should last through time and has a social legitimacy. We don't want these to be isolated, and we think that people that receive these social protection system are people of rights. And this is why we're looking at two different challenges: a reform so we can continue improving with the universal primary health care. And we have two elements that go hand in hand. First, we need structural changes so we can advance. We cannot understand a phenomena from a primary health care without social components. What do we say when we're talking about taking care of people? We have to see the distribution among genders, families, communities, etc. So under this context, we have been working for 6 months so we can think in the interoperability among health services and social services. So we have the understanding framework between two important ministries, but before we were working with completely different codes. So we have to see who has every data, how can we have common languages, how can we go from health, how can we have a real integration of these two different areas, and how can we have these efforts that we already had in each of these ministries, we should change them and we should implement them together. And here is where we're strongly working in something that will make primary health care and the care of people and they should work about social cases and the management of cases with social protection. So we have to create like a puzzle that through a unique window. This would not be the problem of a family, of a children, to have their own way of social protection. But every social protection system should be open for the family, because we know that there should be a care system that should have labor improvements for people and to take care of some vulnerabilities for children. And we have a broad alliance so we can see local social protection that goes beyond technological aspects and should work through the municipalities of the countries. And then we will know that these are sectorial tasks, to tasks that should be have an approach and a complete approach on the different areas. And we have had good results. Value to be able to integrate and to create complete rules for social protection. Thinking to have a reduction in services, because at some case it would take 90 years to receive health attention, and we want to have a reduction in these through these centers. And on the other hand, to be able to have information and evidence how all the assets on the municipalities and the communities have some gaps, or we could use them to improve institutional capacity instead of having these gaps. We have big challenges, of course, because we have to look at things from a different point of view, and we will have great demands for the equipment, but we think there is a big opportunity. And I will finish. We have three challenges. First things, when we're talking a bit about intersectoriality, we think that there should be a better efficiency in public expenditure, because we think that in one moment when a mother goes and look at their social screening and they need economical support, they can be derived to health service if that is so. And that is efficiencies, because we realize that there were, for different things, we had 5 directions working with one person, and that is efficiency of the systems, but also to reduce the waiting time for families. So we should have only one question and one thing, and also increase, and we should also work for national care system in the social health system and the complexity that this implies. And last, and especially that this is the most value, is to recognize that these type of policies that will know the territorial capacities will create local social intelligence, as it was mentioned before. So we can recognize the differences, the difference in the territories, the requirements that are needed, and which are the capacities that are already installed in each of the territories, and instead of going upward down.
Muchas gracias, Undersecretary, and you have a very ambitious social protection agenda, and just listening on how you plan really to make a system which works across sectors, and you have a strong tradition in this country. I can't count the number of times I have spoken about Chile Crece Contigo as a world-class example of working across sectors for social development. So you have many more. I'm sure we will hear many more world-class examples with this ambitious agenda, but you also told us some of the challenges you face, which are also, and we hope that, of course, that policy and systems research can assist you as you move forward. So thank you so much. So we now move to Jeremy Farrar, who, as we heard, is the chief scientist at WHO in Geneva. He's one of several of my bosses here today. But previously he led the Wellcome Trust, which is the world's second largest philanthropy, and as I think many of you know, a major funder of health research, and has a long background in infectious diseases, working for many years in Vietnam. So over to you, Jeremy, to give your reflection, please.
Thank you. Thank you very much, Kumanan. I don't think Kumanan has any bosses, actually, from what I can judge, but great pleasure, ministers, to join here today. Thank you very much indeed. It's my first time to Chile. I hope we'll be invited back again. And also thanks to our PAHO WHO representative here in Santiago for hosting us. I could certainly fall in love with a country whose president never wears a tie, and where it's sunshine in the middle of December is a nice pickup compared to a meter of snow in Europe at the moment. So as Kumanan says, I've been chief scientist at WHO for just over 6 months now, with a background in public health and epidemiology, and almost 20 years in Vietnam, and then for the last 10 years as head of the Wellcome Trust. So I've seen science from being a scientist, I hope still am, from being a funder. Wellcome Trust has $50 billion, and I'm pleased to say we have a Wellcome Trust fellow here from my old life, and now from a public health agency. And each of those gives you a very different perspective. I'm not saying they're good or bad, they're just different. And from where I sit today, the world faces some huge challenges. I don't think there's been another time in my life or career when I've felt that the world has felt so uncertain. We have war on multiple continents. Although Chile may be a little bit protected, much of the world has inflation rates that are not sustainable and certainly not compatible with jobs and opportunities in many countries. We have a geopolitical world which looks very frightening across many different dimensions, east, west, north, south. We're still in a pandemic, but we've come out, I hope, of the acute phase. But the scars of that pandemic will last for many, many, many years. Scars in our education system, scars in the very real sense of inequality in the world, where those who could had access to interventions and those less able did not have access to interventions. And yet, if we look forward, as the world faces deep political problems today, we also face some huge long-term challenges. Climate change is going to affect everything related to health, as many other sectors. Demographic shifts are things that every country needs to consider. Where will we be in one generation's time? I heard this morning that the birth rate in Chile is 1.2. Think that forward for one generation and what that will mean for the age spectrum of Chile, and what that will mean for the workforce versus those that have retired, and what it will mean for healthcare, and how you will structure healthcare in that sort of setting. And yet, in all of that pessimism, and I carry I carry a British passport, so I'm allowed to be pessimistic. There is optimism. And actually coming to Chile gives you some of that optimism, because actually the trajectory of Chile over the last 20, 25 years since the birth of the Alliance has been little short of staggering. Just coming on the bus here, inflation rates, I think, of 3.5%. Most countries would dream of having inflation of 3.5%. Unemployment is 7 or 8%. Inequality compared to most other countries is a fraction of what it is in most countries. And you have an incredibly strong social contract. The most important time to reform is when you think you're strongest. Complacency sets in, I think, in organizations, in companies, in countries, when you think we've done so well, we can just keep going. And this is where I think the fact that today we've met with the Minister of Health, but we've also met with the Minister of Science, Technology and Innovation. That's an unusual twinning in any country. And to me, that gives you an opportunity to think not about what you want to do today and tomorrow, which your president will be concerned about, but what do you want to do? What do you want to be in 10 or 20 years' time? And what will you have to adjust now in order to be there? If that's the legacy you think about, of course you will worry about, as we heard from the Minister of Health this morning when she was given her job, the President said, these are the 3 things, waiting lists, mental health, inequalities. But as you worry about that in the morning, try and step back and reflect and think, where do we want to go? And what will we have to change in order to get there? What will we have to provide through our universities and our research institutes for the young people of tomorrow, that they are equipped with the skills that are going to be required 5, 10, 20, 30 years from now? And how might we reform the scientific ecosystem to make sure that we are prepared for those inevitable changes that are going to come? Because the best way of preparing for any crisis is not to wait until the crisis hits, but to have resilient health systems, to have resilient economies, to have resilient education systems, such that when an inevitable crisis hits, whether it's a pandemic, or it's a natural disaster, or it's a social, or it's a disruption of your economy, there is a certain level of resilience which allows you to go through that and out the other side. And so my 24, 72 hours of being in Chile has both been uplifting because of what has been achieved, but fascinating to think, and we would be delighted from a World Health Organization chief scientist and team to work with you, is what's that next vision? Where does one want to go? And we would love to pair and link what you're planning and what you have done with countries that are not quite where you are yet, but wish to be. And that would be something we would really love to partner with you on in the months and years ahead. So thank you for the warm welcome. Thank you for the smiles throughout all of our visit, a little bit of sunshine, and for a president that doesn't wear a tie.
Thanks, Jeremy, for tempering us with some pessimism, but finishing with some optimism. And as you say, if we can't be optimistic here at this time of the year, where can we be optimistic? I note you said that Chile's growth has paralleled the existence of the alliance. I first came to this country in 2001, not quite 25 years ago. Correlation is not causation, of course, but I think, as you say, the willingness of all of WHO team, really, and the science team which you lead, he really is my boss, to support countries and to learn from. And really, this morning we had the opportunity. It's very rare that you get to speak both to the Minister of Science and the Minister of Health in one morning. So thank you to Minister Asen and Minister Mena for that. And so much to learn from here, and I've always thought that. So I hope we can continue that, and we hope that Jeremy gets invited back as well. Now, we're just going to continue on a WHO theme, if we may. Another member of the science team who's online, and the reason I've been texting is not because I've been not listening, but because my colleague and my friend, compañero, Alain Labrique, who is the Director of Digital Health and Innovation at WHO, and who's down the corridor in between Jeremy and my offices. He's in Washington, D.C. at the moment, but he was very keen to join us. So I hope, Alain, that you're online, and that we can hear you shortly, and that I can hand over to you for your reflections, particularly on the theme of digital health and research and learning required to take forward digitalization, which is very resonant here in Chile.
Sí, buenas tardes. Can you hear me?
Yes, I think we can hear you.
Fantastic. Well, first of all, honorable ministers, vice ministers, my boss and colleagues, distinguished guests, it's a pleasure to be with you. I wish I could be there in person, but I'm celebrating being with you by also not having a tie, as Jeremy has nicely pointed out. Congratulations on this important event, and for leading this really important conversation. I think, to maybe complement what Jeremy has just said, we who work in this field of digital health see ourselves as impatient optimists. We see changes happening around the world, and I think most critically, the pandemic has really shifted the way in which governments around the world think about digital health. There is a clear understanding that we've moved from a state of experimentation, of testing different solutions that can be technology-based to accelerate the delivery of care and improve accessibility of services, towards transformation. So we face an opportunity right now to reimagine systems. At long last, challenging ourselves to think about how we deliver public health and clinical services, separated from the legacy of the paper analog era when many of these systems were first developed. So over the last 2 decades, we have seen a proliferation of digital systems being used to strengthen various pieces of health system functions, primarily focusing, however, on the capture of data and to really deliver indicators on how programs are functioning for the purposes of program monitoring and program reporting. But WHO and many academic partners and implementing organizations around the world have also been conducting rigorous research to understand the ways in which digital tools can address persistent, frustrating health system challenges. What are those potholes that we encounter on the road to trying to achieve universal health coverage or primary healthcare goals through the effective coverage of interventions of known efficacy? So can digital health be used to fill some of those potholes in that highway to effective coverage? And so the answer is yes, because WHO in 2019 developed the first landmark guidelines, evidence-based guidelines, with 10 recommendations that suggested ways in which ministries of health could use digital solutions to strengthen birth and death reporting, to strengthen continuity of care, to strengthen the training of health workers and providers, and adherence to guidelines. So despite having that evidence in place, we still find ourselves facing significant problems and challenges in the delivery of PHC. But one of the things that the pandemic did also demonstrate is that the piecemeal approach to using technology solutions here and there across the health system was not adequate to address the health system strengthening goals that we've set for ourselves, including pandemic resilience. And so this we see as a major tipping point to get all of us thinking in the health systems research space, as well as in the digital health space, to think about the foundations, the standards, and the systematic investment in evidence-based solutions, and the enabling environment required for those solutions to be interconnected, to be offering individuals a person-centered health experience. One of the things that we've also seen through the research data is that pandemic resilience was intrinsically linked to digital capacity, and that the level of technical readiness of a country, not just in terms of the number of projects, but also in terms of the capacity and enabling environment, was also linked to pandemic outcomes and the fatality associated with COVID-19. So this really speaks to the extent to which investments in building blocks, in the governance and leadership and services and the standards and interoperability, as well as legislation and policy that has to be in place for digital to be truly effective, is absolutely critical. But this also needs us to recognize the importance of capacity building and training a workforce to use digital tools effectively, not just in using data for decision-making, but in implementing the solutions that are being developed by digital innovators. I think the investments in foundations that Chile is poised to make and has been making reflects some of this this comprehension that you must create a soil that is fertile enough to really grow the seeds of innovation. And I think that's often neglected or has been neglected over the last 15 years, where we have planted innovations hoping that they will flourish without thinking about the necessary components of the enabling environment, the leadership, governance, policy, and capacity that have to be in place. And so I think we do need continued substantial research agenda around identifying what are the necessary and what are the sufficient investments that will enable that transformation to take place. And WHO is firmly helping to lead and strengthen country capacity in undertaking that transformation journey. A couple of important tools that I will leave you with. One is the Digital Implementation and Investment Guide that was developed a few years ago by WHO that depicts a systematic process of identifying national priorities and the associated digital investments to strengthen those priorities, developing a digital health transformation strategy and costed roadmap, as well as the enterprise architecture, including the governance and policies that need to be in place to facilitate digital transformation. We're also working on an exciting project known as the SMART Guidelines, which are taking WHO technical guidelines and converting them into a machine-readable format. One of the initiatives that is being taken up with great popularity across member states in every single region, because it allows local entrepreneurs to build solutions in Chile, in Argentina, in Zimbabwe that respond to the needs of that country, but integrate the latest WHO guidelines into the technical systems that are being developed without the heavy lift of coding and translating human readable language into machine readable language. So we're looking forward to continue supporting ministries of health and government writ large in undertaking the process of digital transformation. Other sectors such as finance and education have done this with great success and are not looking back. And we have a lot of support from leadership, including Jeremy and our DG Tedros, to focus our efforts and help countries undertake this journey in an evidence-based, research-informed way. Thank you so much, and looking forward to joining in the Q&A session.
Thanks so much, Alan. We really appreciate you joining us when you're in a range of meetings in Washington, D.C. But I think you've articulated well the WHO's approach that you very much lead. He's a very popular person at WHO in terms of people asking for help. But also, I think the commitment of science team and broader WHO to support ensuring there is fertile soil so that digital health is systematized, is able to overcome those potholes, as Alan said. And Alan, I can very much recommend that we've had so many discussions this week around digital health. So hopefully after Jeremy and I leave, you will also still get an invitation to come to Chile, because there's a lot to learn from here. So now we'll move to Gabriel Rada. And you founded an institution here in Chile that does world-class evidence synthesis. So great to have you here and to hear how you're very much leading around how research and knowledge can inform and be useful for Chile to address its challenges. So over to you, Gabriel.
Thank you. Gracias. Voy a hablar. ¿Se escucha? Sí. Voy a hablar en español.
I will speak in Spanish. Thank you, first of all, for the invitation. It's a real honor to be able to share with all these members of the panel that are at the world level, and they have a great point of view of those topics that we're discussing. Thank you to the organizers. Really, it's a pleasure for those who are leaders in Chile. I can see that there are many women. It's really nice to see how they have been taking their positions here, and they're leaders in decision making in this area. And yes, of course, my role in this area started as a physician. I am an internist, and when I was working in the hospital, I realized that it was really challenging to be able to synthesize all the scientific evidence to be able to look at these hospitals. And there we see the first seed of what it is, the epistemonic foundation. So we have to create a databases, and through innovative technologies at that time, but now they are not so new. And then we could generate something that could facilitate this process. So there we started with the epistemic data, and then we created the foundation, not only to maintain these databases, but it was to take the evidence to those decision-making spaces. And then we should take the scientific evidence to ministries, to scientific organizations, all of those that are working with the health services in different ministries and other public administration services, to have evidence, to know what is useful and what is not useful. And this was a very important challenge. One of the first challenges that we realized is that the amount of evidence was increasing. At that time, we had some collaborators that we identified the evidence and to upload it in one place, and with around 500 people working for about 4 or 5 hours per week, we could do it. But our projections in relation to the capacity and capability of the people, but the amount was okay, but the amount of evidence was, was overwhelming. So we saw that the scientific evidence is continuing increasing, and we haven't still reached the plateau. It's still increasing the amount of evidence that we're receiving, and we have to capture data and generate data from users and the different systems, as we said. So we have to obtain the information in real time from the different devices on the clinical files. And so we have to deal with all the data that is being produced. So it's a big challenge to have all the information at the service of people that are decision making. And this is more difficult than what it was some years ago. Although technology is increasing, like artificial intelligence, and that has been developed for many years, but this year has a high level. And but I would say that we are the amount of evidence, the amount of data is growing quicker than what we can process. And we have been dealing with this problem for a long time ago. And we think that we are capable of processing scientific evidence quicker than many other people, many other groups, but we are not as quick as it is needed to make the real decisions. And it is complicated for health systems. Nevertheless, when we are far away from clinical medicine or health, and we start talking about scientific evidence in healthcare, these complications are greater. But when we try to abandon this silo of health, and we have to think in how can we talk about environmental challenges, educational challenges, and how can we copy the same system further beyond than health for other things than health. So we would like to create some bridges among the different silos that we have in research. So there things are even more complicated. And when the alliance was have been for 10 years, and I had a project that I had to be leader of this project, and we were trying to develop certain type of technologies based on what we had 10 years ago. But how can we put all the evidence in one place? How can we identify all the system in health system policies and to be able to process that in an easy way? And at that time, it was complicated from the technological point of view, but we have to decide what do we think, what is the research of health policies. How can we organize? What is included in these? Which are the interventions? How can we organize knowledge? And in the group with which we were working in other projects that were related with systematic reviews, and how can we make sense in these policies so we can, at a global level, and then to inform our local decisions. So to have all the information in one summary, in one article, so it would be useful at every level. It was complicated and it is complicated. The way that we have to call for different interventions is different. To extrapolate what we're doing from one country to another has many differences to try to identify that we can predict if these health policies will work in one country or in another country, which will be the impact in vulnerable populations, how different health or environmental aspects, social aspects of health will have an influence on the different policies or the different characteristics of health services. We still have the same problems. We have to agree upon in how to organize knowledge, which is the quality of the investigation so it will be useful, which are the needs of each of the countries. And that is complicated, and the amount of information that is being generated is complicated. And then everything has to be done on time, and that is different. So technology has advanced since we created this foundation, and with all the technological methods and the technology that has improved, we think that we have improved. It's different what we do now than what we did 10 years ago, but we haven't reached the Ministry of Health, the Ministry of Health or Science, or other entities. And we can say that here you have scientific knowledge, so you can use it whenever you need it. We're not prepared to give evidence ready to be used in the right moment and in the right place. This is a challenge that we haven't solved yet. But I think that the only way that we can solve these is that different actors, different silos should communicate among themselves. And that is something that we haven't been able to achieve. During the pandemic, since Epistemonico and other places, I had to participate with different groups that they had a great energy and they were willing to solve this problem. The evidence that was being generated in the pandemic with vaccines, public policies for public health, social measures, and the impacts of the pandemic for vulnerable groups. And they all say we have to work together. And that energy, the willingness that they had, and I had never seen that before. I don't know if this will happen again, that all scientific groups will start working together to have some time of achievement. That was fantastic, that we all worked together. But the structure of how do we get to an agreement, how do we collaborate among each other, the resources that we need for that, the amount of information that was produced that overcame every group and every initiative failed. So for every citizen that tried to continue or to follow up this scientific discussion of what was useful or what wasn't, if it was during the pandemic, the vaccines, public health services, etc. Although every organization in the world worked together, we failed. We failed. So I think that some of these groups are saying, okay, how are we going to face our next challenge, our next pandemic? And so we have to get ready. We have to take care of the preparedness. So then we see for a next time what challenges as we have to work as it was in the pandemic. How can we create a robust system so different actors, different sectors can work together to be able to solve all these great challenges? And at last, this interface between the decision-making world and the scientific world is something that is difficult. We're still not working together. As this old book was saying, scientists are from Mars and decision making are for Venus. So I think there's no connection, and this is a big challenge. And I hope that these type of initiatives and organizations like Alliances will start with these work and start closing these gaps, and so that scientific evidence will be to improve health of people. And I know that's plenty to be done there to get the two worlds together.
Thanks so much, Gabriel. You obviously have a lot of experience in this perennial challenge of translating data and research into usable information that people can use to make decisions and improve outcomes. So thanks so much. So we now move to you, Carol Zabaleta. And I mean, you're talking about perhaps the greatest challenge of all, climate change for health. And of course it is, we've just had COP and the first health day at COP, but we know that's perhaps one of the challenges it's easy to feel pessimistic about. And I know you specifically work with the challenges for Indigenous people. So please, over to you, Carol, for your reflections.
Thank you so much. And first, I want to introduce just myself and say that I am Carol Zabaleta from Peru. I'm a physician and also completed a master's in control and infectious diseases. And then my PhD was in human geography. So first, also I want to say thank you to this beautiful land, Santiago de Chile. I think it's important, especially coming from a Quechua family, but also because working in climate change made me. No sé por qué estoy hablando en inglés. Perdón, creo que es porque.
I'm sorry, I don't know why I wasn't speaking in English. I guess I usually do this in English, but now I know I can do it in Spanish. So what I wanted to say is that working for so many years in climate change has made me realize that we need to be aware of our connection with nature and with the environment where we live. So that's why I wanted to thank the organizers as well as the Island for receiving us and for enabling us to be all connected together here and to be able to understand and look at what are the advantages of developing this research on policies and systems, especially for countries such as ours in South America. Thinking about that, I need to tell you that I am here because I'm leader of one of the projects that was awarded at competition from the Alliance to be able to reinforce health systems in 6 different countries in the world. One of them was Peru, working with indigenous communities and also with the health officers from the Ministry of Health of Peru. So this, well, maybe you know this or maybe you don't, but it is important to know that the impact of climate change in health for South America are related to the vulnerability of our health systems, care systems that we have in hospitals and others, because when they were created, we did not bear in mind that the climate issues would be a threat for the results that we are now looking at, for what we are used to. So although this is recent information, the studies reveal that we need to be prepared. And I will have to be a little bit pessimistic, unfortunately, and hopefully I will finish with another positive thought of what has happened in Peru so far. But it's important for us to realize that the diseases as we know it are going to continue, are going to be part of our world. And not only that, but we are going to be faced to new conditions that were not responsibilities of the health system, such as what was mentioned at the beginning that is related to social protection. But what will happen is that with all the climate issues, the ways in which we will see people getting their living is going to be impacted, and that will create, of course, things such as migration, loss of our cultural way of living, our way of understanding, and our own values, because we will have to change what we will see, the way in which our kids has seen things. And although it is important that it's not the responsibility of the healthcare systems, and also it's going to be an issue on what we are going to be looking at in the health system. So that implies that for workers or in terms of their research, it means that we will need to be prepared to look at other initiatives, other disciplines, which is what the panel members have been looking at already. We have to look at other disciplines and also room to work in an intersectorial manner. We need also to look at the lessons learned from the pandemics, the things that we learned when we had this shock, this quick, sudden shock of our health system. Well, similar things might happen or are already happening, as a matter of fact, with climate hazards. So we need to bring that back to us. That's how I started working with the alliances on the systems in Peru. Before working in the health systems, I was working in climate change with indigenous communities. And during the pandemics, we undertaken a study where we assessed on a monthly basis what was the impact of the pandemics and how these communities were responding to that. That's what they were doing from their own knowledge and resources. And we learned that we have all those capabilities at a community level that are being activated through the agency, as they call it, as the social scientists call it, but it is basically what they have learned throughout generations. And indigenous communities have that not only in Peru and Bolivia, in other areas, but also local communities, because at the end of the day, we learn how to live with our environment. But those communities that are closer to nature are those that also have more present how these changes impact their lives. That's how I started working on this area. And what we have done so far to start off is to understand first what is the health system, because the health system might change according to the context, countries, according to the populations or cultures. And what we learned is that these systems go beyond the health sector. We understand that this is also related to private areas, or what we call the civil society organizations. This is important because when we have these shocks that are related to things such as the pandemics or to climate issues, the health systems saturate. So we have to go to these other subsystems, and that would be private world, and the civil society in order to articulate ourselves. And we need to do this from beforehand. The first way of preparing ourselves is through that. Now, the second part is that health systems have 6 dimensions, and this also helps us to have an holistic sight on how things work and how we deliver those services to people, to patients, and to our population. So through research of health systems, we can generate evidence on each one of those 6 dimensions. That includes finding, that includes preparation of health workers, the information systems, governance, etc. So if we look at those 6 dimensions, we will be able to find information at a local level, at our institutional level, and also interconnect those 6 areas. Finally, to continue with our conversation, what I wanted to mention in a practical manner is that in Peru, what we find that works in these regions is that in order to prioritize all these resilience roads, that's how we call it for climate change, we need to work with the community. But it's not only with people, individuals, but health workers, because the ones who are really receiving that are communities and health workers. The ones who are on the crops, those are the ones that will see floods or drafts, the increase of rainfall. All of those changes will impact first them. So we need to prioritize and create those dialogues between community and health workers and the authorities of other subsystems so as to prioritize it. Just to give you an example of what are the things that have been prioritized through these workshops is a radio program about environmental health. The reason is that in the area where we work, environmental health is not part of the training of the health worker, and it is something that we have sort of lost in our communities. So both ends were interested in generating this knowledge and also to have a radio program, because many of the ones we have amongst our population do not have access. I mean, radio is the most accessible or affordable communication media, and it could also be fruitful to alert towards any climate change. So you can see that through that perspective, we can help on preparedness. But it's important to talk about the next steps. And that's where we see the possibility of generating funding to engage community workers or the indigenous wise men to help in recovery. Just to take a look at mental health for a minute. There are some specific things that arose out of these workshops to look at each one of the components, for example, of the mental health care, facing risks and recovery after climate hazards. And finally, I would just like to mention that as a South American woman, as a Peruvian woman, I see how important and rich our region is. We have so many cultures. In all the Americas, we have more than 800 different ethnias. We are rich in biodiversity and we are rich in territory, land, and climate. So I think that's exactly where, as South American, as health personnel or staff or people, we need to generate evidence so that it would be useful for our communities to face those climate change issues now, things that are happening, and also in the future.
Muchas gracias, Carol. And I think your words about the need for social participation, both in the response to climate, but sort of reflecting the diversity of the peoples in this region and the need for participation in the production of the research, and also research that is useful for communities to address these multitudes of threats which can seem quite daunting. So as always, our most scarce resource is actually time. So we probably won't have time for the Q&A. But I just wanted to just ask one, perhaps give the Undersecretary the last question. Having listened to this, and you have this very ambitious agenda, what are the sort of key, one or two key questions that for you, for your agenda taking forward social protection in this country, which has to deal with evidence synthesis, is taking advantage of digitalization, is trying to ensure that Chile is resilient for the threats of climate change? Are there one or two key research questions that you need support from the research community to take your agenda forward?
Creo que ahí está. Yo diría que para nosotros el primer tema es cómo nosotros
I would say that the first point would be
justamente
how we
ir
can
dándole sostenibilidad,
somehow give certain sustainability, financial sustainability mainly, to the efforts that we are doing in an intersectorial manner. I think that there is a challenge right there, because there's not only scientific work, but also political agreements and financial agreements. Now, and on that regard, for sustainability, I think it is also important that research could be delivering or giving light on which is the virtuosity of being ahead of certain possibilities for the future with older population, age population, or an imminent crisis. So if we can create evidence that states that each dollar that we are investing today will translate in decompressing future pressures to the health systems or care systems, but also to the wellness for each one of those families, is something that we need so as to deplete all our efforts. And I think that many times the partnerships that we can have in terms of research and evidence generation and how we can prospect the best decision-making processes to try to decompress the effects in the health system that we certainly look at, and we can see that the window of opportunities to increase the institutional capacity is smaller, is meaningful in terms of effort. And the second thing I would mention, the second key issue is the way in which we can make progress in terms of innovation, because many times we see that the health area moves forward in the use of technology in quite an accelerated manner in terms of interventions, but also those social interventions, and we have already mentioned that to our Ministry of Science and Social Intervention. This could also be a challenge to generate innovation processes at a technological or intersectoriality level with our stakeholders, and certainly in the practices on that are going to enable that social sanitary levels. I think that improving and prospecting our investment better, that's the first one, and the second, the capacity for social innovation. Those are the key challenges that we have.
Muchas gracias. So I think you'll all agree we've had a very rich discussion this afternoon on, firstly, I think both Helen and Jeremy have outlined the complexity and the gravity of the interlinked challenges that we face, and that Chile, like many other countries, is at an inflection point, which in the decisions being made now that Jeremy's mentioned several times this week, will determine our future, our combined future, and the future of individual countries. But at the same time, we see that people are rising to meet these challenges. So in Chile, and the Secretary, you've outlined how social protection is being taken forward, building on the strong base in the history, linking to primary care with an ambitious reform, taking advantage of digitalization, trying to work across sectors. But I think, as you just concluded, there is the need then for research and learning to meet the needs of policymakers, to help you decide what are the best choices, what are the best policies, how can you make your efforts sustainable, how can you work across sectors. So that's not just information about the effectiveness of policies, it's also information science around how to do things, how to implement things, how to address governance. And I think then you're lucky in Chile, you have people like Gabriel who have worked for so long on evidence synthesis, how to convert data and research into usable information that can influence. When we face a proliferation of data, often we have so much data, a proliferation of academic journal papers, how can we bring it together and synthesize so we understand and make the most benefit of it? And then I think Carol and Alan have addressed two of these great trends in our time of digitalization and the need for decarbonization to address climate change. And so Alan and Jeremy have been very clear on what WHO has to offer with our HPSR colleagues to support countries. And I think, Carol, speaking very much to the need to action, to be with communities, to be informed and led by communities, whether that's at research, whether that's at decision-making, whether that's supporting capacity and resources and determining response. So I'd again just like to thank all our panelists. I'd like to thank our hosts. Thank you, Helen, for the keynote. And before I hand back to the Master of Ceremonies, and just for us at the Alliance, just to say, as with the whole science team and WHO, we're committed to rejuvenating our relationships with Chile and the region, and so that we can work together to improve, to have high quality policy and systems research to help countries solve their challenges. So please join me in thanking all the panelists. Muchas gracias. And
thank you so much.
Bueno, agradecemos a cada una de las integrantes del panel
each
de
of the
conversación
members of the panel,
el papel de la investigación en
the
política y
role of
sistemas de salud
research in systems and
y
health
para
policies.
dar algunas palabras también
So
a
we
modo
can
de
also,
reflexión. Queremos
words
invitar acá
we would like
a
to
la señora Isabel
invite
Echeverry,
Ms.
ministra de
Isabel
Ciencia,
Echeverry.
Tecnología,
She is
Conocimiento e
Minister of
Innovación de
Science,
Chile.
Technology and Innovation
Muchas
in
gracias,
Chile.
ministra.
Thank you, Minister.
Muy buenas tardes a todos y a todas.
Good afternoon.
Partí la mañana como con un poco
I
de
started this
depresión.
morning like a little depressed.
Todos a veces en el gobierno, pero estoy
We have
tratando de
some
tener un
heavy
grado de
days
optimismo
in the government, but I'm now
fisiológicamente
really
hablando,
optimistic. I am
el cierre de
pathologically
octubre me
optimistic.
hizo reincidir.
And so
Em,
this is what happens
Me
in
pidieron
my
hacer una
I had to think about future. That's what they asked me. And thinking in how to start and listening to the members of the panel, I would like to remember 3 moments of this last month. I had the privilege to be in the Antarctic with the General Secretary of the United Nations. That what we saw was the impact of climatic change and also the difficulties of the work of those scientists that are now in the Antarctic, and many of the research that are now being analyzed in the some of the things that I learned is the currents, how they go through the Antarctic, and this is what creates the biodiversity and ecosystems of the world. Yesterday, I was in a school in Lo Espejo, which is a community in Santiago that is very vulnerable, where students of high school students, we talked about artificial intelligence, and all of them use different chatbots of GTP or artificial intelligence chats with different objectives. Some of them because they wanted to learn and improve their capacity. Those were less of them, but the majority were using it so they could play with all the risks that are associated to use that they're using these type of tools like artificial intelligence. And the third thing is what happened this morning with the Minister Aguilera. We went to a public hospital in Aguiné where we are installing a robot that has been manufactured by Chile and with the capital from different parts of the world that uses artificial intelligence and technology. Why do I present these 3 moments? Because these climatic change challenges, challenges of digitalization and the incorporation of technology, challenges of how can we maintain and how can we create social networks in a context where we have a great amount of uncertainty and questions. So this is not scenario for the future. It's not a science fiction movie, or it's not something that we are afraid that could happen in 5 or 10 more years. This is something that is happening now. And when you look at these from my point of view, from the point of view of my ministry, this could be overwhelming. How can we have an approach to all of this? And maybe I think I should run away and somebody else should take care of this. Oh, how we are lucky in our country that we have been working in these last years so we can create these building blocks that were presented by Alan and will allow us to face these challenges in a different way. And this is based on science and technology. And this is a great opportunity where we're facing challenges of climatic changes. We do not only have a scientific base, we have a law, a Marco law that will have 10 of 12 ministries to be adapted to all the problems as we have from health services and working. We have to think on the diverse public policy based on climatic changes, adaptation, with science development as a basis of these decision-making. When we're thinking of these technological advances, we have generated not only capacities in connectivities, in digitalization of the state, but we also advance with the law of interoperability of the states. So then we can have standards like projects mentioned by the minister. If we need some information, we don't have to ask for the same information like 10 times. Everything is centralized. And this was done by our own researchers in Chile. And then they could support the public policy decisions that at a certain moment were like strange, that are difficult to implement, but we are facing the challenges in a different way now. This has opportunities and also great challenges. We talked with the members of the alliances about the opportunities. We have economical development. We have possibilities of economical development linked with technological development. We are creating our public policies, and this is a great change. And I think that it is important for our country, and it has amazing benefits in welfare. I think that what was presented by Ministry Gallegos, that working with the health service and other ministries, we can see how this is of a great welfare for our citizens. But we have big challenges also. How can we, with a question made by Jeremy, where we want to be? And the challenge is, how can we implement all of this? We have all the pieces, all the building blocks, but we have to get them together. We have to put them one beside the other. So we have the institutionality, we have the capabilities. Now we need the health service should have these mitigating measures, and we have to see how we can create these future health services, how we can make our decisions for infrastructures in case of vaccines, for example. How can we have an approach of citizens when facing the health services? I'm looking to my citizens because they are working in interoperability and they're doing an amazing job. We need things to happen, and they could go beyond the great amount of cultural differences. And it needs to take care of what Gabriel was saying. How can we take this evidence? This is a question that we have all been making, and this is difficult, very difficult. And I would like to take the words of the moment, and we need help. That is true. Not because we're small, and Helen was saying, and we're proud of what we're doing. It's because these are very difficult challenges. We have a fertile soil, and we can improve for implementation processes, but we need this help, the expert help that is coming from science, but also from international area, because this is the way that we can improve and to make the best use of what we have been able to achieve. And I would like to give you a thought of something that was named by the members of the panel, and I think that it is relevant. That is the democratic crisis that we're living at a global level. Now, it's not only climatic change, not only digital transformation, artificial intelligence. There is another crisis of democracy that is deep, and we are here, and it is related with what we have been talking today, how public and state can present solutions to citizens that have their own demands and they have their own expectations. They're different and complicated, complex expectations. And I would say that we're all struggling and we're losing that struggle. And we have to be sure of that, especially when we are in a group like this, when we are talking about global challenges and we made our decision in that we want to work with an international collaboration and to do this based on people and communities as a respect and maximum care and taking them as our first priority. I think that this should be part of the conversation of this group and other groups. I think that we should take this as our priority everywhere we go, and I think this should be what we will bear in mind for future decisions, because if we make these implementations, we will be able to face the different challenges and the challenges which are of our concern. So thank you so much. And congratulations for the 25th anniversary of Alliance. And thank you because I had a great day so I could think and to have a hope for the future. So thank you so much. Well, with the round of applause for the Ministry of Science and Technology, Knowledge and Innovation, Ms. Echeverry, we would like to ask for a final words to Dr. Janet Vega. She is the Vice President of the Board of Directors of Alliances for Health Research Policies. Thank you. After the great win the great discussion and the marvelous panel, there's no much to be said. I think that for us, it is very important that we had the chance, first of all, that the board of directors and the group of the alliance came to Chile and that they decided to have their meeting so they could plan the future 5 years. And mainly because I say that this country doing many things, but we don't speak too much. It's like an insular country. So in the different assemblies, in the different congresses, as a country, it's like we take notes, but we don't talk about the things that we're doing. So I think this is a big opportunity, so then you can know about us a little more. And it is relevant also for us because during this period of these days, we start connecting with people and we start thinking in some alternative of international support, and that we can also give support to some international institutions. So this is a great opportunity. So we can open a collaborative working space. We are a country of high incomes in general. Our challenges from the economical point of view is not great as of donors as it is needed in other countries. But we are a country that is open to have the support of collaborative world and of different points of view. So I have to thank, we're really happy, and I would like to invite you to use the space, the moment where we'll be all together. So everybody that's here will have the opportunity to talk with the members of the panel, with the members of the board of directors. We have here our own Michelle Bachelet from New Zealand, as I say, Helen. She is well known in the whole world. We have the scientists from the WHO. They are great authorities here. So I would like to invite you so that feel free to get close to different people and talk about anything that you would like. So thank you so much for coming and thank you so much for being here.
Well, after those final thoughts of the authority, we are closing this day of the 25th anniversary of the Alliance for Health and Policy in Systems Research. We would like to thank everyone who has been here with us today, here on site and also online. And we would like you to participate in the cocktail that we will have right outside of this meeting room. Thank you.